Okay, we're here again with Doctor's Corner. We have Dr. Fred here, and we're doing follow-up from last week. So the conversation is, who is the best candidate for the natural hormone-free, natural modified, or stimulated cycles? Go ahead.
Thank you, Melissa. So in keeping with what we were talking about last week, the natural IVF cycle is a cycle where you're probably going to get one and sometimes two oocytes or eggs, and then therefore one or two embryos. So if you ask me who the ideal patient for this is, it's a young patient who has a reason for IVF that is either a tubal obstruction or a male factor or something that is, or even a lower ovarian reserve, a young patient. And the reason for that is because even though you get one or two eggs, there's a high probability of them being genetically normal, so euploid. And so there's a higher probability of success as opposed to when you're a patient who's in their 40s, 41, 42, 43. Now, the other patient who is a good candidate is a patient who has a contraindication to a high hormone level, so a high estrogen level. And this used to be really a great indication. So for example, someone who has a risk of pulmonary embolus or whatnot. But these days, we have to realize that even on a stimulated cycle, we can give letrozole and we can manage to keep the estrogen level very low during a stimulated cycle. And therefore, the risk of complications is very low. The other patient is the patient who doesn't want to have a stimulated cycle for a reason as long as the patient understands that we are in a way there's a lesser likelihood of having an embryo to transfer at the end of one natural cycle versus at the end of one stimulated cycle. So this is what I usually tell my patients. And then when they factor in their personal preference, the financial aspect, the medical contraindication, indication for IVF, and so on and so forth, we usually come up with a solution, be it natural, modified natural, or stimulation, or mini stim, which is a lower dose of stimulation.
Fantastic. Yeah, thank you for that explanation. It really gives us an idea of the type of candidates and things like that. So excellent. So yeah, we'll see you next time. Enjoy your week. Appreciate
My
the time.
pleasure. Have a good week, everybody.
Thanks.